Just bring in Dr. Rochelle Walensky, an infectious disease expert who will become director of the CDC when President-elect Biden takes office tomorrow. Dr. Walensky, thanks for joining us this morning. You don't need Senate confirmation, so you will become CDC director tomorrow. What's the first thing you're going to do when you take charge?
Good morning, George. Thanks for having me. You know, we need to reset the stage here. We need to make sure that the country, the people understand that this pandemic is now going to be addressed with science, with trust, with transparency, with communication of exactly where we are to the American people. Yes, I will be sworn in tomorrow, but the work has been happening since I was named, and we've been working really hard to make sure that we can come in and hit the ground running and make sure that we can get this country back to health.
This has been an unusual transition, not a lot of cooperation at the beginning, at least, of the transition. How big of a challenge is that?
You know, I've been working closely with the agency review team. That team has been really helpful for me in trying to get up to speed with where we are. Certainly, communication in many of the other agencies might have been better, but we've been hitting the ground running, and that's how we intend to move forward.
President-elect Biden has an ambitious goal: 100 million vaccinations in the first 100 days. What are you going to need specifically to meet that goal?
Right. We have a really ambitious but doable plan. We need to make sure that we have the people, the vaccinators on the ground. We're going to, use commissioned medical personnel. We're going to use military medical personnel. We're going to look at retirees. We're going to look at upper-level nursing students, medical students, so that we can really get enough people to be doing the vaccination. We need to really understand what our supply looks like, how many doses are going to go to which state, so that we can really make sure that the eligibility is on track. We don't have long lines, long waits, but we're vaccinating people in the proper queue. And then we need to make sure that we can bring the vaccine to the people, to many, many places. These will be community vaccination centers. They will be mobile vans. They will be qualified health centers, federally qualified health centers, and pharmacies. So we need to make it really accessible, and all of that plan is underpinned with equity. We need to make sure that we're equally and equitably getting the vaccine across this country.
That's all common sense. How come it hasn't been done?
You know, I don't want to judge where things were. I will say we have, it's been historic that we have 2 vaccines in less than, in about a year's time. And we have the hard work of making sure those vaccines now get into arms. And you're right, I think this plan makes sense, and we're looking forward to implementing it.
The Trump White House has overturned some travel restrictions in the final hours. President-elect Biden's press secretary, Jen Psaki, said last night that he intends to tighten the restrictions. What should we expect?
You know, if you look at the fatalities of 400,000 that we're likely to hit today, if you look at our cases across this country, I don't think now is the time to encourage people to get on international flights, to encourage people to mobilize. I think now is the time to really buckle down, double down our efforts. And so I don't expect that we will be lifting travel restrictions. And if anything, I think we can expect that they might tighten, especially in the context of variants that we're hearing about.
Dr. Walensky, you have a big challenge ahead. Good luck with that. Thanks for joining us this morning.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.